So my name is Bob Guldberg. I'm Director of the WUSI Human Performance Alliance at Oregon and a Professor of Bioengineering, Director of the Night Campus there. And as one of the people that got to be on the Zoom call when Clara told us that she was doing this, and it was a dream for all of us, I have to say it's just really almost chilling to see it come to life and to start to see the results. And we have a lot more work to do, but it's really great to see this really coming together and seeing the synergies. So what we're going to do this afternoon is we're going to have a session on regenerative medicine and rehabilitation. So what is regenerative rehabilitation? It really is taking and understanding that this knowledge we're learning about how tissue responds to mechanical stimuli, which is advancing all the time, interfacing that with regenerative therapies and trying to synergize them in order to achieve peak function. And so if we think about some of the really ambitious goals that we're trying to achieve here, it's to synergize two parts of clinical care, athlete care, that are often very different, which is the regenerative medicine part or the surgical part and the rehabilitation part. As part of that, we may need to learn about what's happening in the regenerative niche, and so things like implantable sensors that enable real-time, patient-specific, controlled rehabilitation would be amazing to have. Building the world's most complete set of performance organoids, these in vitro model systems that allow you to create patient-specific, human-based models for bone, cartilage, tendon, ligament, and muscle. Developing strategies to prevent or reverse fibrotic scarring following soft tissue injury. And really, as we learn more about the tissue biology and the effects of the mechanical environment, wouldn't it be wonderful if we could predict injuries before they even happen? And so these are some of the ambitious goals that we're setting out to try to achieve.